Hello. I quickly want to familiarize you with the H-Wave device before your H-Wave consultant performs an instructional session. Let's begin by opening the case. First, unclasp the lid, and inside the contents will be the H-Wave device itself, a charger, a small bottle of aloe vera gel, and 2 lead wires, one gray and one black. In the back pouch, you will find some paperwork. Any paperwork that needs to be completed and signed will be taken care of by your consultant during this instructional session. So we'll put some of this to the side for now. The instructional booklet for home use, on page 3, your consultant will review with you both the indications for use as well as the contraindications. On pages 7 and 8, your consultant will actually draw out a customized drawings for you based off of that treatment. So let's get started with the device itself. First, press the power button across the top. Across the top, as the screen lights up, you will see a meter that registers the battery level. As the device is used more frequently, you will see the battery meter drain, and it will get to a point where it beeps and flashes, and it will actually state low battery. At that point, you will take out the charger, and there's a charging port on top of the device, plugs in, and the other end plugs into a wall outlet. A fully charged battery should last roughly about 10 hours. To charge the device, it should be about 8 to 12 hours or overnight. A key note to charging: the device will not operate if it is plugged into the wall outlet. It must always be disconnected. Next, the lead wires. As stated earlier, one gray and one black. On the device, there is a channel A and a channel B. We'll take the gray wire into the channel A, and we'll take the black wire into the channel B. A and B. Next, we're going to pull out a pack of electrodes. Open up the Ziploc bag. The electrodes have roughly a lifespan of about 20 uses. In order to care for the electrode, after each use, place back onto the clear plastic, back into the Ziploc, and seal up. If the adhesive loses its stickiness or you get anything onto the electrode itself, you can possibly use a small drop of water and just rub it in and let sit face up for about 10 seconds to see if it actually rejuvenates the stickiness. Also, never put any kind of soaps, solvents, or cleaners onto the electrode itself. There's also a small bottle of aloe vera gel, as we discussed earlier, okay? This is used to help increase and make the device feel more comfortable and as strong as possible. To utilize the gel, you can do this one of 2 ways. You can take a small pea-sized dab of the gel onto each electrode and just use your finger and rub it in. Another way to do this would be to take that same pea-sized dab of gel onto the area to be treated, rub it in, and then wait about 10 seconds, let it dry before putting the electrode on that portion of the body. If we go back to the device, there is also a timer on the device. So as I hit the power button again, we'll let the screen light up, and across the bottom you're going to see 4 zeros. The device has the capabilities, as far as the timer, to go in 15-minute increments by pressing the set button. So as I hit set, it goes to 15 minutes, 30, 45, then 60. The timer is only used as an option and does not operate or control the device in any way to turn the device on or off. All treatments should be at least a minimum of 30 minutes. This will be discussed with your consultant during your session. Next, we're going to go through the steps to use the device. First, we would take about a pack of electrodes, and we're going to use our lead wires. And we're going to take the gray, and we're going to push that all the way in so it stops, and also the second one. We're going to do the exact same thing with the black wire. As you will discuss with your consultant during your virtual session, they will discuss the ideal body position you're going to be in your home that's the most comfortable for you, and they're also going to establish the best treatment protocol and where to place the electrodes on your body. So let's get started. Press the power button, and next we're going to talk about the frequency. As you can see across here, there is a low and a high, a low and a high. So a low and a high for each channel, A and B. This cannot be operated if the device is on. so I cannot depress this. It has to always be in the off position for either channel. Just so you're aware, any combination could be utilized, and this will be discussed with your consultant during your session. There might be a low and a low combination, a high and a low combination, possibly a high-high combination. But that, once again, will be discussed with your consultant. In this example, I'd like to do low on A and high on B. The low frequency is going to create rhythmic visible muscle contractions. This flushes out waste and increases blood flow to improve recovery and long-term pain relief. It will feel like a pumping heartbeat type sensation. The high frequency will feel as though it's a buzzing, deep vibration, and when turned on, will create immediate pain relief. Here are the intensity level indicators. It starts at 0.0 and goes all the way to 9.0 as maxing it out. Click the intensity knobs on and slowly work up each intensity dial based off the specific instruction from your consultant. In general, the higher the intensity, the better the result will be. Contractions are normally strong and visible, however, it should never cause any sort of discomfort. Once the treatment is over, you will make sure the device is in the off position on the intensity knobs and press the power button. At that point, you will detach each lead wire as well as the electrodes, place back into the Ziploc bag, and everything goes back into the case.